Welcome back to Therapy Thursday. Today we're going to do week 2 of a 3-week installment on the research paper that Dave was talking about last week. For a brief review of the paper, click on the link below. Today we're going to be going through stage 2 exercises of a 3-part exercise series. If you want to review stage 1, again, go to Dave's blog, and for next week we'll look at stage 3 exercises that are a little bit more advanced. So try these 2 exercises out for stage 2 rehab of somebody with mild to moderate osteoarthritic changes and meniscal damage.
Our first example of a phase 2 exercise is called the clock lunge. You'll see here pylons set up to mimic the face of a clock. Now it should be reiterated that the goal of phase 2 is to increase the individual's strength within their available range of motion. The range of motion exhibited here by the lead leg is shown to be superior to that with somebody with mild to moderate osteoarthritic changes and meniscal damage. So to overcome that, we can change and use our arthritic leg as a plant leg, in this case the person's left leg. That way the person's having varying angles and varying depths as they go around the face of the clock. Once you progress past that, you can then use it as the lead leg and slowly increase the person's depth as well as their strength. Our second exercise example is called a band-resisted step up and step down. Here you just see little bands with varying strength that we're going to tie around the individual's knees. We're also going to use implements seen here like a plyometric box, or in the actual exercise seen here, a padded plyometric box. So with the band tied around the knee, it's just going to provide a little bit of a lateral challenge to the individual as they're doing a slow and controlled step up and step down. We're going to slowly increase the height of the step up and step down, however the cues are going to remain the same. A, to stay in control with a nice slow and even tempo. B, to keep the knee out over the toes as you're slowly progressing that depth. So we saw it with the lowest range, now we're going to show it with the second highest range. We're then going to increase to an even higher range that the person can get into full flexion, bearing as much strength as possible, and that's going to be seen here. The entire time we're trying to focus on cueing the hips to stay out and increasing the person's strength as they gain adequate depth. So this is just an example of an exercise progression, but there's numerous other strength and depth exercises that an individual can go through in phase 2.